This state has actually decimated funding for mental health services. NAMI Chicago suggested that nearly 5 million Americans who live in Illinois, 5 million of the 9 million, are suffering from poor mental health.
So we brought in all the local agencies. That's regional. So that's why DHS is here, DMH from Madden. We brought in the state. We brought in the 708s, which is the mental health commissions, because we are the funders. Sometimes these agencies, all they have to depend on us, and we don't have the pockets that the state does. So we try to do what we can to support them, but we can't cover what the state is cutting.
Indeed, this is unprecedented that we are finishing the fiscal year with no budget at this point. So it certainly has had a great impact on our providers and ultimately our consumers.
We have a really strong infrastructure, and as that begins to fail, our clients are lost in the abyss and they don't know where to access care. And unfortunately, without a healthy system of prevention, education, treatment, compassion, and safety, our clients are the ones that lose.
The township has oversight of the Mental Health Commission. And I just spoke with one of our executive directors of one of the agencies we do fund, and they're so thankful for the mental health commissions that they are able to continue to operate.
It snowballs. They lose those state revenue. They have to lay off people. They lay off people. They can't provide the services. That creates waiting lists. Then when they create those waiting lists, then those that do have the resources, the waiting list becomes 6 months, 8 weeks, 9 weeks. So and then those people end up on the streets. So what happens then? They don't get the services. They decompensate. They end up in the ER. They end up in the state institutions. They end up in jail.
Government has to lead the way and provide certainty for these organizations. If there is no certainty, if you don't know whether or not your funding is going to be yanked away from you from year to year or from month to month, then you don't have any certainty. The best thing that government can do, state government, county government, is make sure that we provide a safety net that is strong.
These agencies are the ones that provide all the mental health services. They deal with the depression, they deal with the postpartum, they deal with the substance abuse, the substance affected, they do the inpatient, the outpatient services, they do the family groups, the domestic violence shelters, these are the homeless shelters. These are all the core programs that keep a community safe and healthy.